Hi, welcome everybody. Thank you for taking the time to join us this morning. So my name is Tim Allen. I'm an Admiral nurse working here at Great Western Hospital along with my colleague Hannah Rogers. So we're representing Great Western Hospital and an organisation called Dementia UK. Hopefully lots of people that are listening in have already been taking part in Dementia Action Week, and you might have heard Hannah and myself chatting earlier in the week on Tuesday about our role here in the hospital and in Swindon in the community. So just going to take a few minutes today to talk about dementia care, more specifically to the hospital, both here in Swindon, because I think it's really important to bring the focus locally, because we are part of Swindon Dementia Action Week and the Dementia Action Alliance, but just to talk about the present and the future of dementia care in the hospital a little bit more widely. I think it's really important because I think in the last 18 months, the hospital, I'm sure, has seemed a very frightening place to be, really, or a frightening place to come to. And I'm sure it's the sort of place that none of us really would have wanted to be at unless we absolutely had to be, really. And if I hadn't been working here, I'm sure that would have been the case for myself as well. So part of our discussion today, hopefully, is about just giving people a little bit more of an insight into kind of the care and treatment that takes place here, obviously, especially for people with dementia, and just try to encourage a little bit of a bridge, really, between the hospital and the community. So when we look at people with dementia that are coming into hospital, especially for those people, it will often be a very confusing and frightening experience. Obviously, it's by necessity for most of the time that people need to be here, but we are conscious, I think as Admiral nurses and other colleagues as well, that this hospital stay can have a significant burden for people. It can have a negative impact on their physical health, their mental health, their emotional well-being, and their cognitive abilities. So there is lots and lots of that's been written, not just here in the UK, across Europe and the world. And I just picked out a statement there from the World Alzheimer's Report, which goes back a few years now, that identified significant gaps in health care, service and research around the hospital environment and care for people with dementia. So consequences, I don't want to kind of dwell on negatives too much, but we'll just talk a little bit about consequences and then hopefully move on to some more positive things. The consequences for people with dementia admitted to hospital can include an increased risk of mortality. Physically, people can lead, so it can lead to things such as increased likelihood of falls, a functional decline, increased disorientation, and thereby an increased reliance on caregivers at the point that they might be discharged. And you may have heard this term that I've just made reference to in the slide there called pajama paralysis. And I think the statistics are quite shocking, really. So if I am an older person, if I've got significant frailties in a number of areas, even a hospital stay of just a few days can equate to months and years in terms of lost functioning and lost independence. So this is why it's really crucial not only to provide first-class care, but also a first-class environment, and an environment that considers the needs of people with dementia especially. And also, again, just repeating really that the impact is both from a physical health point of view, but certainly a mental health point of view. We talk lots about acute confusion or delirium, which some of you will be familiar with, which is an additional component that people and guidance, policy documents, government guidance states that the ideal really is that we have person-centered principles in mind when we're caring for people with dementia. And I'm just going to go on to talk about what person-centered principles actually mean. So a gentleman, unfortunately, that's no longer with us, by the name of Tom Kitwood, who was a professor in social psychology back in the 1990s. He coined this term, person-centered care. And did a lot. I'd like to think that actually lots and lots of his work, obviously it's been adapted over the years, but these basic principles are still in evidence really when we're talking about excellence in dementia care. So he talked about person-centered care as having 4 key elements. It was about valuing the person and those who care for them, treating people as individuals, attempting or doing our best to look at the world from the point of view of the person with dementia, and to provide a positive social environment in which the person living. So in a lot of ways, those things we'd hope should be kind of common sense really, but unfortunately, as we know, in systems, in big systems, in hospital systems, in terms of government and authority, often common sense seems to us to be sometimes lacking, but really it's about seeing past the diagnosis, if you like, really, understanding that this person might have dementia and understanding the difficulties that that brings with it, but at the same time understanding so their historical likes, their dislikes, the preferences, how they like to be treated, and who is important to them. So bringing things down to the built environment and the fabric of the buildings, if you like, really. So some of you might have heard of an institution called the King's Fund. So this is a charitable organisation. It's an independent organisation. And this is an organisation that has produced lots and lots of guidance, which hopefully authorities, hospitals and other agencies will access when they're looking at trying to improve health, care and welfare provision in their various settings. There are some specific templates that staff can use, provided by the King's Fund, that provides a lot of guidance to facilities managers, to estate managers, and others when we're considering whether buildings, areas and wards can be truly dementia friendly. The King's Fund have come up with these 7 guiding points or principles, if you like. I'm going to mention in a few moments some work to the hospital here, and we'll kind of refer back to these points because it sort of highlights the things that we want to achieve here, certainly at Great Western and Swindon. So does the environment promote a meaningful interaction between patients, families and carers? And a lot of that is around spaces, appropriate spaces in the building and outside of the building. We all know probably, stereotypically, we think about kind of old-fashioned hospital wards as long corridors full of beds on both sides. So those are not particularly conducive to interaction between people. We don't have those kind of wards anymore, fortunately, but nevertheless, there's still lots of room for improvement. Follows on to the next point as well about, does this environment promote well-being? Is it comfortable as it can be? Is it as safe as it can be? We're aware, obviously, people here are here to provide a healthcare service, to be treated from a medical point of view, but nevertheless, there's still things that we can aspire to and look towards creating in these environments. Does this environment promote active engagement of people with dementia in their care and treatment? Do people with dementia feel safe, secure, that they're in a comfortable enough environment to be able to express their needs and wishes for as much as they're able to? Are they able to have suitable meeting places with their family? Does the environment welcome support and input from people's significant others? Does it promote mobility? Shared areas, communal areas, are they safe? Are they well lit? Are they appropriately furnished and decorated? Does the environment promote continence and personal hygiene? Do people have ready and easy access to toilet, bathing facilities? They have to walk very far to get to those facilities. Are they clearly signed and marked? Are there staff around to support that person if they need help? That follows on to point 6, really around orientation. We're going to get to lots of discussions around making corridors, communal areas more obvious, thinking about the appropriate use of lighting, the use of colour, to understand the environment that they're in, because we're bearing in mind that people are here for a reason, that they're physically unwell probably, and if they've got dementia as well, we want to work exceptionally hard to make sure that person, as much as they're able, is able to navigate their environment, because we know that, again, physical independence is really important. We don't want people to feel so anxious or frightened or threatened that actually they're just, they may be staying in their bed, or they're just sitting in a chair by the bedside. We want to feel that people are encouraged to share their space. It's about calm, which probably seems a very distant objective in the hospital, but again, we can work to reduce. We can try to provide more suitable spaces for people, and again, so, and I'm going to sort of bring things back to Great Western now as well, really. Can we, and do we want to provide opportunities for somebody with dementia to be given a chance to engage in activity, interest, and to express their personal preferences? So we can think about those things in different ways. How do we engage people? How do we make sure that people are not just left sitting in that chair beside the bed? How do we make sure that they're not just left, behind a curtain in a corner of a ward area? So we can, fortunately, think about things like technology. My colleague Hannah was recently in touch with another organisation, another charity. So just as an example, that was able to provide us with some free MP3 players. So some headphones and some little MP3 sets with pre-recorded music on. So we've been able to give those to some of our older adult wards. I've got the word Rita there just to explain that. So that is, it's an information technology assistant. It's essentially a large television screen that's hooked up to a computer, but it's very easy to use. It's very interactive. It's just a case of touching the screen, and there's all sorts of pre-recorded content on there, music, old films, clips from newsreels, access to old newspapers, some games. So we've got one Rita machine, which is up on Tia ward, and that's something that some of the other wards in the hospital can access. I'm going to talk about something called a magic table as well in a moment or two. So this is a wonderful piece of equipment. Again, it's very interactive. It essentially projects images onto a blank surface, so any flat blank surface, so such as a tabletop, for example. And again, it's something that people can use alone or maybe as a group as well. So there are things that we can use from an IT and information technology perspective that can be really helpful, both for the person, but for them to engage with, for them to use with their family, perhaps with a carer, and for them to use with staff as well. Having those things is great, but we need to make sure that there is some suitable space for those people to be able to use them. And we're going to talk about spaces on wards in a moment again. And this is about providing opportunities for, I've kind of dressed it up in language, fancy language maybe around cognitive stimulation, but essentially this is something that I can do, that I can engage with, that's going to interest me. So, and that can be anything from drawing, painting, reading, engaging in a board game with somebody. So this is going to stimulate me, it's going to engage me, it's going to hopefully be a part of my care and treatment. And it's as important, I think, for somebody with dementia as anything else. Space for carers to be involved in those activities also. And some hospitals, and we're looking at this hospital as well, have already developed some areas outside of the building. So we know that some hospitals are starting to redevelop or redevelop spaces, redundant spaces, into garden areas. So, which would be absolutely fantastic, really. So just giving people an opportunity to be able to step outside into the fresh air, and as much as they're physically able, to be able to have some other kind of activity. Again, it's about interaction with others as well. It's really important. So those are principles, and I'm going to give some evidence of examples in Great Western shortly. The next slide really is about what the hospital does here in Swindon to endeavour to make sure that they are recognising our patients with dementia as having that condition, and thereby hopefully making sure that staff are aware of that person's needs and aware of the adaptations that they would be able to put in place to make that person stay as comfortable as possible. So Nerve Centre essentially is an IT system that is being relatively newly used at Great Western. It's been in operation for about 2 years now. It is a live patient information system that can be accessed both from a desktop, a laptop, but also lots of the staff here will have small handheld devices, little iPods that they can access Nerve Centre on. I think one of the benefits of it is, and not all new technology is necessarily helpful or beneficial, but I genuinely think these sorts of things are, because staff can update information immediately, and immediately other staff will be able to see that updated information. We've got inbuilt to the system dementia and delirium screening tools. So historically, when somebody came into the emergency department, for example, even not so long ago, they essentially staff, doctors who clerk people into the hospital would have still been using a lot of paper recording. And I think there was an increased risk with that older system of people's diagnoses being missed or overlooked. And thereby you've got somebody potentially coming into hospital and spending some time here where their diagnosis, their difficulties are not going to be properly recognised. So as part of Nerve Centre, we've got delirium and dementia screening tools built in. And if the staff that's are booking in that patient or clerking in that patient, which is usually one of the junior doctors, don't complete that dementia and delirium screen, they get a little red flag coming up, a little message basically prompting them to do that. So it minimises, probably doesn't entirely mitigate the complete risk of some things being missed, but it really, really cuts down on the chances of a really significant diagnosis like dementia being missed, for example. It also encourages staff to pick up on delirium. And without going into too much detail about delirium at this moment in time, essentially that's an acute confusion on top of any other condition that somebody might already have. So again, it prompts people to think about delirium because it's really important. It's a very under-recognised condition, but it has a huge bearing on somebody's care. So there are assessment tools on Nerve Centre. We've got dementia flags I've made reference to, which is literally what it says. It's a little red marker, an alert that when staff are looking at that person's record, that lets them know that they have to make adaptations. We've got a new pain assessment. Again, Hannah, myself, lots of staff that are particularly passionate about dementia care also have been historically very concerned that pain is under-recognised and under-managed in people with dementia. And like anybody, this is a significant part of somebody's care and treatment, and you've got under-recognised pain or pain that's not adequately treated. This is going to have a huge bearing on that person's well-being, and it can potentially lead to more challenges if somebody is on an inpatient ward, for example. So we've got a new electronic pain assessment tool being built into Nerve Centre, and again that's going to prompt staff to make sure that that assessment is undertaken. And we've also got frailty indexes. Again, this is a tool that staff, doctors, nurses, other people have to complete, which again will hopefully make it much more likely that somebody's individual needs are brought to people's attention and adequately addressed. We've got patient headboards. These are just magnetic whiteboards behind patients' beds that flag up different types of difficulties that somebody might have, and that's around dementia, falls, visual impairment and hearing. So again, this is just a simple tool that perhaps some of the nurses or the nursing assistants can just mark up, so that it's about kind of sharing information appropriately. It's making sure that everybody, from somebody that's bringing the meals to somebody that's doing the nursing to the medical staff, is aware of what that person needs. The This Is Me document, Kat yesterday on an earlier session was making reference to This Is Me. but this is a really important document. It's a personal history, if you like, really, or a personal statement of likes and dislikes. We really encourage all our patients with dementia and delirium to have a This Is Me, to have it completed and to have it visible. So that's the other thing. We've had a few campaigns in the hospital around visibility as well, because it's all very well having these documents filled in, if they then get tucked away in nursing and medical notes, for example. We want them filled in and we want them visible. And one of our nursing assistants more recently has come up with a hospital passport, which essentially is for the hands-on staff, really, the staff at the sharp end, the front line, people that are doing the hands-on care. Again, this is about a communication tool, really. So that's quite new. That's an idea that's come from one of the nursing assistants up on Teal ward, one of our elderly medical wards. So that's something that we want to develop and use. So these are communication tools, often for people with dementia, but actually they can be adapted to people with all sorts of communication difficulties as well. So all of these principles of what we can call person-centered care. So there is a comprehensive document here at Great Western called the Dementia Care Pathway, and there is also a delirium recognition management pathway as well. So staff are able to access these documents. They're shared with everybody here. They're comprehensive, and they've got lots of references to the things that I've already mentioned. So things like the This Is Me, things like the pain assessments. So really, there's no excuse really for people not to know that these things are available, because they are. And we want to provide person-centered care, and actually the hospital does support us in providing that care. It's just making sure, again, it's just repeating and reinforcing that message. So that's a big part of our role, or the role that Hannah and myself have here. Moving on from that, again, staff training. So looking at the reports from earlier, staff training in dementia awareness has been historically recognised as a gap or a deficit. So we have got an established academy here, which Hannah and I do contribute to from time to time. We've got an academy lead that coordinates and delivers a lot of the training in dementia. So all new staff will have an e-learning module to complete around dementia awareness, and then there is additional training at what we call tier 1 and tier 2 levels. So those are just more in-depth training, really. So all staff have to complete that basic awareness module, and then the other modules are optional at the moment, but we really we want to work with the academy and making sure that people are accessing as much learning as they can. We've got Dementia Champions Day, so every area, ward, department, team, whether they are typically looking after people with dementia or not, will have a designated dementia champion. We have Dementia Champions Days because we've got one today, and we have Dementia Champions Network. So that's really important, because I think Hannah and myself are two in a big organisation of 4,500 people. So we rely a lot on disseminating messages about dementia, about person-centred care through our Dementia Champions and the Dementia Champions Network. And on Dementia Champions Day, we invite lots of speakers, be it from Alzheimer's Society or Swindon Carers, to come in and contribute to those days so that we can get access to the best or the widest amount of knowledge and expertise available. We've got a fantastic organisation of volunteers here, and we've got some volunteers that work specifically on the dementia side. One of our volunteers is currently looking at what we've called a memory support service, which is essentially having a number of identified volunteers to support people at mealtimes, for example, or again, to act as signposters really to appropriate services, perhaps to have a chat with carers and family now that they're able to come into the hospital a little bit more, to make sure again that when their loved one leaves the hospital, they know where to go to for additional sources of support. And without blowing our own trumpet too much, obviously we've got Admiral nurses. So we've been here, as we've mentioned earlier, for about 2 years. We're here to meet with families and to offer support to families, but we're here a lot to support our colleagues. So we are available to give advice, to training, education, support and best practice to our colleagues. We often. So yesterday I took part in a short session to our emergency department colleagues, and then next week we've got some sessions with staff on Beach Ward, which is not a dementia ward at all really, but staff there expressed an interest in having access to some training. So that's a big part of our work. Again, it's about disseminating the message of person-centered care, recognising the needs of people with dementia and their individuality. And obviously events such as this one, and being able to participate in Dementia Action Week and raising awareness. So the hospital is, Great Western Hospital is signed up to the National Dementia Action Alliance Charter for 2020. And the Admiral Nurse team here take part in regular dementia strategy meetings and carers committee meetings, along with the offer of some public health discussions as well. So locally, every 2 or 3 months, ourselves and lots of stakeholders, so some of the organisations I've mentioned already, such as Carers, Alzheimer's Society, Swindon Borough Council, the police, we have carers representatives. We get together for some of these meetings to look at what's happening in Swindon, but also to look at regional policy and national policy around dementia as well. So we hope that in that way, everybody's kind of voices are able to be heard and can have some influence as we look towards the future. So just sort of a final slide, I'm just going to try and talk or give some examples really, because I think these things are all very well that we're talking about in principle, but we're evidence in practice of what's happening. So 5 or 6 years ago, Jupiter Ward, which some of you might be familiar with, Friendly. So there was a significant refurbishment of that ward. So the built environment, the fabric of that ward was kind of recommissioned, redeveloped. So Bay areas, for example, had separate little nursing pods put into them rather than having one central nursing desk on the ward. The flooring was redone to be non-reflective and to be simple, so as to minimise the risk of falls and confusion. And we're referring back to earlier when we talked about being able to feel safe and secure and to be orientated within our environment. We had dementia-friendly clocks installed, some new artwork on the walls. So there was a significant refit of that ward, but that is quite a few years ago now, really. Bringing things back to the present day. So we've been fortunate, and I say we, Hannah and I have been fortunate with, we've got a very supportive matron here in the hospital when it comes to dementia care. So of 3 dementia resource trolleys. So my colleague Hannah has put these trolleys together. We're going to initially have these trolleys on Woodpecker, Teal and Jupiter, which are predominantly our elderly medical wards, and where you'll find an awful lot of our patients with dementia. They are going to be literally trolleys, and they're going to be full of all sorts of great resources, activities, games, puzzles, books. So they're going to be fantastic, really. So we started taking delivery of those literally in the last couple of days. Brighter Futures, who are the Tall Charitable Fundraising Wing, are purchasing more dementia-friendly clocks to go around the building as a whole. They are in some areas, but we need to get them in more. There has been, there's an underway program of development or redevelopment in the building, in the fabric of the building. So some of the flooring areas in the main corridors have recently been revamped. Again, looking at non-reflective surfaces, plain surfaces rather than sort of patterned and check things, which can be quite confusing for some people. We are in the process now of refurbishing one of the communal spaces on Teal Ward, which has been a bit neglected historically, and we want to refit that as a dementia sensory and reminiscence room. So we're going to purchase some wall art. Again, one of our trolleys will be sort of in that area. And I'm just going to make reference because this is quite exciting. So there's a piece of fantastic equipment called a Tofa Tafel, which has come over from Holland. And this is the equipment I made a point about a few minutes ago. So this is a fantastic, essentially it's a projector. It hangs from the ceiling and it projects these fantastic interactive games onto a plain flat surface. So a table, for example. So, and people can sit around this table, and as this machine is projecting these images down, people can actually interact. So they can reach out and touch an image and move it around, for example. They can play games. So let's say you could have a game of drafts or chess. It will project the image of the chess board onto the table, and people can reach out and touch the pieces and move them around. So it's just arrived. It's still in its box at the moment up onto the award, but hopefully next week or two that will be available for people to use. Mentioned the Rita earlier. Another Rita machine has been purchased for the emergency department. So that will be available very shortly. And Brighter Futures are continuing to work on their dementia fundraising scheme. So they've got a long-term target of in excess of £300,000. An amount of thousands has been raised already. This is a long-term target, £300,000, but we've made some way towards starting to build up that figure already. And all of the money will be used for dementia resources. So if anybody has been to the site recently, you might have noticed that there are some things taking place around the building. So there is a new urgent care, or there's a process of demolition at the moment. The old urgent care Clover Centre has been demolished, but there will be a new urgent care centre up and running in roughly a year's time. And from there on, there will be an expanded emergency department. So Hannah and I have already had some initial discussions because we would like to be involved as much as possible, going back to the King's Fund, which I mentioned earlier, and being able to have some influence on the environmental design of these new buildings when they come along, because I think this is a real time of opportunity to have some influence for years to come on the built environment, and therefore our patients with dementia, hopefully, both in the present day, but also in the future, will maybe feel that the hospital is a less frightening place, a less threatening place, that they will feel safer, they will feel more secure, and that people will recognise their needs more and have those person-centred principles in mind. So that's all for me. Thank you. So I think I'm just going to take a moment or two just to see if anybody has got any questions at all. But otherwise, thanks very much for your time, and I look forward, hopefully, to having some contact with all of you again in the future. Thank you.